patients that I would probably initially advise against a cosmetic surgery procedure would certainly be smokers. And not that I have anything personally against smokers. I have family members that are smokers. The issue really comes down to the potential risks that occur during cosmetic surgical procedures. In a smoker, there's a higher risk of complications, both tissue healing problems, higher rates of infection, and a risk of tissue death, and we call that necrosis in medicine, that can occur. So if a patient's a smoker and they undergo a significant surgical procedure at substantial cost to themselves, they kind of want to make sure that things work out well. So by far, it's in their best interest not to consider any surgical procedure that's only done for purely cosmetic reasons while they're smoking. Now, those patients may be excellent candidates once they've stopped smoking for a significant period of time. Other people that I would advise against pursuing cosmetic surgery are those individuals that aren't able to accept the risks of surgery. And I always tell patients that the balance that they have to consider is simply their desire to go through a surgical procedure and their motivation compared to what they hear about the risks of surgery. It's simply a balance. If when they look in the mirror every morning, what they see annoys them or frustrates them so much that they're well willing to accept the risks of surgery and undergoing a procedure, then they're a good surgical candidate. But if they're not willing to accept those risks, then they shouldn't think about surgery, because surgery comes with risks. And unfortunately, over time, things can happen. And it's important that a patient understand that. The last type of patient that I would advise against pursuing cosmetic surgery is the individual that has external motivations for surgery that aren't really their own. So when you discuss and talk with them, you get the sense that it's not really them that wants the surgery. They may be motivated to have it because of a job or because of a loved one. And teasing out those motivational factors are very, very critically important.